From KETV Investigates, doctors at Nebraska Medicine say there aren't enough black dermatologists, which can cause problems for patients needing the right treatment.
They want to change those numbers, improve them, and offer better care for black patients with a specialized clinic.
Quinicia Fraser introduces us to the clinic and the doctors making a difference.
For MJ Adams,
I had some discoloration on my cheeks and things.
Finding a dermatologist of color was a struggle.
I had a doctor once who told me, you should go to, she referred me to a doctor of color in Washington.
Through her own research, she found the doctor she needs, Dr. Erin Barrett, who leads Nebraska Medicine's Skin of Color and Ethnic Skin Clinic. Barrett says 90% of the clinic's patients are black, and that's part of why she's concerned about a shortage of black dermatologists locally and nationally.
Nationally, 13% of our population are African American or black, and only 3%, according to the latest statistics, of dermatologists are black doctors.
The black dermatologist who used to run the program is no longer seeing patients, but there are 2 black dermatologists in residency at the clinic.
The feedback that I get at this clinic really just warms my heart.
Dr. Kayla Clark is one of them.
It's so humbling. I'm the first doctor in my family. And so at many points along the road, I didn't think that I would make it here.
Clark says her son's experience with a bad rash led her to her career.
He was admitted for something called eczema herpeticum, which is an infection that people can get when they have eczema, and in children it could be fatal. So after that happened, it opened my eyes to the world of dermatology and how conditions can present differently in patients with skin of color.
Clark and Barrett say that skin of color often needs to be treated differently than non-skin of color.
Usually our textbook shows conditions in patients with non-skin of color, and rashes often present red in patients with non-skin of color. But in my skin tone or someone a little darker, it can be more violaceous or purplish. Often these differences in presentation leads to delayed diagnoses and sometimes misdiagnoses.
And speaking of misdiagnoses, Clark and Barrett say nearly 1 out of 4 patients have a change in diagnosis when they come to the clinic.
We see this a lot in hair loss, actually. So a lot of times they will be diagnosed with the most common, hereditary hair loss in a black individual. And when we see them, we see, oh, actually they have something very different, like centrocentrifugal cicatricial alopecia, which is a different type of treatment that we need for that patient.
Barrett says people of color also tend to have pigmentary issues.
When they get common conditions like eczema, acne, they're more likely to have scarring and hyperpigmentation that linger.
Clark says different needs are part of the reason representation is crucial in healthcare.
I think that one of the major things we have to do is just have pipeline programs early, teaching children about dermatology, getting them linked into medicine, showing them that they can do this.
She wants aspiring black dermatologists to know that they can make a difference so that patients like Adams can be their very best.
So we don't take care of ourselves, how we'll be able to take care of everybody else.
In Omaha, Quinicia Fraser, KETV, Newswatch 7.